Hi everyone, welcome to my channel. This is Josie's Point of View, and our focus today is on veterans healthcare. If you're new to my channel, I want to say welcome. I'm glad you've decided to tune in, and if you're a returning reviewer, by all means, so glad you've decided to come back. Our story today comes from Beckley, West Virginia. Take a look at the headline. And it reads, VA doctor guilty of sexually molesting male veteran patients. This is going to be a two-part series addressing sexual misconduct by doctors within the VA hospital. There was so much information that it was difficult to condense it into one video. So this is part one today, and I'll follow up with the second video next week. And as always, I'll place links to a few of the full articles in the description box. As an added precaution, I want to stress that all of my videos are appropriately classified as required by YouTube, and it clearly states they are not suited for children. However, I want to stress this again by adding an additional disclaimer since this video specifically deals with mature content and certain body parts are mentioned. It's probably no different from what you review every day on YouTube, but I need to stress once again, it is not suited for children. I plan to leave out some of the really salacious aspects of the case, but my objective is to provide just enough information to get my point across, so let's get right into it. And our story today comes from the VA Medical Center in Beckley, West Virginia. This hospital has been serving that community since 1951, and it provides healthcare services to 11 counties in southern West Virginia. And as you can see, it's a pretty big hospital. In addition to the main hospital and clinics, there's also a 50-bed community living center. And even though I did not research this part of it, it's probably one of the major economic pillars of that community. So it does a lot of good for a lot of people. But there seems to be a lot going on in Beckley these days, and I'm going to tell you all about it. And we were also talking about this man right here, Dr. Jonathan Yates, age 51. He worked at the Beckley VA Medical Center as a doctor of osteopathy or a chiropractor. And in this capacity, he was seeing veterans, and these veterans were his patients, of course, and they were seeking relief from chronic pain management. And that's usually why you would go to see, one of the main reasons why you would go to see a chiropractor. Well, according to reports, Dr. Yates was scheduled to go on trial September 22nd of 2020 for sexual misconduct involving veterans. Well, before his trial could begin, he pled guilty to federal charges that he molested male veterans who were his patients and that he violated their civil rights. And before we get too far into the charges, let me give you some history on this case. Now, patients had been complaining about one specific healthcare provider for quite some time, and by February 2020, a total of 37 alleged victims had come forward through an attorney with complaints that during the course of their treatment, they had been fondled and that what took place had nothing at all to do with their treatment. And by this time, 14 of these alleged victims had filed complaints directly with the West Virginia Board of Osteopathy, and all of these complaints were against one single doctor, and his name was Jonathan Yates. And I'm sure this information or this case became center stage within the state of West Virginia. And as the information became more public, Dr. Yates is fired from the VA, and you now have every possible agency involved in this investigation: the VA police, the Attorney General's office, the VA Inspector General, multi-agencies, both inside and outside of the VA, were now involved. On April the 2nd, 2020, it was reported in the news media that Dr. Yates was arrested, and the Department of Justice announced that they were filing civil rights offense charges against him, and they were asking anyone with additional information to come forward. And what they were really doing, they were asking if there were additional victims out there, they were encouraging them to come forward and share their story. By May 2020, the number of veterans filing a complaint against Dr. Yates had grown to 43. Now, I should say 43 that were working with this one attorney. There could have been more, but there were 43 that were working with this particular attorney. And by now, everybody's talking about this case. And I could only imagine how stressful it was for the employees to come to work every day and knowing that this type of investigation was taking place. But yet the VA had not issued a statement on the case. Several witnesses came forward. One veteran said he was referred to Dr. Yates and he specifically told the doctor he did not want his neck cracked. He said Dr. Yates locked the door and proceeded to massage his chest, calling him a real man. The witness said Dr. Yates then pulled down his boxers and started grabbing his penis to the point of pain. He said the doctor continued despite being told to stop. During that same appointment, the veteran stated that Dr. Yates slapped him on the backside and cracked his neck, even though he asked him not to do so. And by cracking his neck the way he did, it left the veteran incapacitated, which means he could not move. And this also caused him to have a lot of pain. And you know what happened after that. Several other victims reported having a very similar experience with Dr. Yates, which means he did the very same thing to them. There was also a statement from another doctor who worked with Dr. Yates, and this physician reported that Dr. Yates would sometimes say things along the line like, I'm not able to explore the things I'd like to do with some of these guys because I'm a married man and my wife wouldn't understand. And that's a red flag right here for me because you would think that if his peers heard him making such remarks that they would report it. They could have reported it anonymously up the chain of command, but I guess that was just part of the culture of this facility. Certain behaviors by employees were allowed to get out of hand. Dr. Yates was free to do as he pleased, even to the point of sexually abusing male patients. Makes you wonder what was going on with the leadership during this time. And on May the 12th, 2020, a Charleston, West Virginia grand jury issued a 7-count indictment against Dr. Yates. He was officially charged with 5 counts of depriving veterans of their civil rights and 2 counts of abusive sexual contact. And I was a bit surprised he did not specifically refer to it as rape. And here are a few explanations of the charges. The indictment alleges that Dr. Yates examined 6 men at the Beckley VA Medical Center and that he sexually molested them between September 18th and February of 2019. The indictment states that he temporarily immobilized one of the men by cracking his neck and using acupuncture needle on the others. He then sexually molested them while they were incapacitated. The indictment further states that the abuse caused 5 of the men to suffer bodily injuries. So in other words, what he did to them caused them to have injuries after he did it. He also engaged in sexual contact with the men without their consent. And keep in mind, all this was going on inside the Beckley VA Medical Center in Beckley, West Virginia. Now, on June the 12th, 2020, finally the VA got around to issuing a statement, which was more defensive than anything else. It stated that as soon as they found out, they immediately got the Inspector General's office involved and they fired Dr. Yates, but that was not really true. That was just a cop-out. The statement was not accurate. They should have known earlier because veterans were complaining and they should have taken action much sooner. And as always, they're always saying that it's an isolated incident. But no, it was not an isolated incident because this stuff has been going on for quite some time. It was a chronic problem. And it's amazing when a lawsuit is involved, that seems to be the one time the VA is willing to say we took the necessary steps. But based on everything that has been published so far, that situation and that abuse by Dr. Yates had been occurring for some time, and the VA had done nothing at all to stop it. A criminal trial for Dr. Yates was originally scheduled to begin in July, but there were ongoing delays and plea negotiations, which caused at least 3 different postponements to the trial day. And finally, it was set to begin in September, but he agreed or he consented to a plea agreement around that time. And under this plea agreement, Dr. Yates admitted to the sexual abuse under the pretense that it was legitimate medicine in 3 instances, and that he deprived the individuals of their constitutional rights to bodily integrity, and that he caused them pain. A whole lot of words, but he seemed to have been able to make most of the case disappear because he only pled guilty to 3 cases. And he's scheduled for sentencing on January the 4th, 2021, when he faces a maximum of 30 years in prison. Well, it's difficult for me to find the right words right now to express my emotions, and it's really sad to know this type of abuse was allowed to continue for as long as it did. Over 43 veterans filed a civil suit against the VA for sexual abuse, and I'm sure there are many more out there because Dr. Yates' behavior did not happen overnight. In my opinion, he had been doing this type of sexual abuse to veterans for quite some time before he was stopped, and to me, that is just despicable. And as a veteran, I'm heartbroken just to think about the pain he caused so many of my fellow comrades. We deserve better. And a system that allows this type of behavior to cultivate and to grow is simply unforgivable. The entire leadership should be fired. But I'm just as disturbed by the medical providers who had prior knowledge of Dr. Yates' intent, the administrators who did not have a clue or chose to turn a blind eye to what was taking place, and to the light sentence I anticipate he will receive when he is sentenced in January. Because you see, he has already managed to make most of this case disappear. And you see, the VA's punishment most likely will just be a slap on the wrist. He probably never served jail time, and if he does go to jail, it's going to be very little because that's just the way the VA works. They don't value us. They really don't give a damn. Yes, I anticipate a slap on the wrist while my fellow veterans spend the rest of their lives dealing with the trauma and the shame of being sexually assaulted by a medical provider within a VA hospital. And if you're shocked by this type of behavior by a medical provider, and you should be, well, there's more to come, so stay tuned for my next video. And that's all I have for you right now. Feel free to leave me a message below and let me know what you think about this video. And by all means, feel free to like and to share. And if you haven't done so already, I want to invite you to subscribe to my channel by clicking on that red subscribe button on the bottom right-hand corner of your screen. And if you click on this notification bell right here, you'll be the first to know whenever a new video is uploaded. I thank you for watching, and I'll talk to you soon. Bye.